Hi, I'm Jordan King. I'm an associate professor at the University of Utah, and I was the chair of this American Heart Association scientific statement on single pill combination use for the management of hypertension.
Thank you, Jordan. My name is Robert Brook. I am a professor of cardiovascular medicine at Wayne State University, and I had the pleasure of serving as the vice chair for this scientific statement.
So as we all know, high blood pressure is one of the most common and preventable causes of major cardiovascular events such as heart attacks and strokes. We have really good medications. We have medications that are effective, they're safe, they're low cost, and yet we see blood pressure control rates have been stagnant and poor for decades. So it's not an issue of we need or we don't have good medications, it's how we use those medications. And one of the biggest problems we have is that most patients need more than one medication to control their blood pressure. But it's really common to see medications get prescribed one at a time and then intensified over time. But what ends up happening is that a lot of patients never get off of monotherapy, or they get onto regimens that aren't guideline recommended. And one approach to overcoming this is single pill combinations. So single pill combinations are pills where you take two or more active pharmaceutical ingredients, so two or more medications, and you put them into a single pill. And so this simplifies prescribing for physicians in theory, and it makes it simpler for patients to manage their medications and be more adherent to the medications. So these pills have great promise to improve blood pressure control. They have not been used at the rate that we would potentially hope that they get used. And so we wrote this statement to evaluate the current state of the evidence around these medications.
Thank you for that background, Jordan. Let me just briefly cover the three main findings of the review of our scientific statement as covered by our working group and our writing group. First, we found that the use of single pill medications was shown to improve medication adherence, and it does achieve faster and long-term superior blood pressure control. And in fact, it may even lead to improved cardiovascular outcomes. Overall, the use of single pill combinations for hypertension was found to be cost-effective and really had few pitfalls. Most patients with hypertension, our group concluded, including those with stage 1 hypertension, should strongly consider initiating therapy for high blood pressure with single pill combination medications for hypertension, or change to a single pill combination when warranted. And then finally, a major conclusion was a review of the overall evidence suggests that the optimal combination for reducing cardiovascular events is a renin-angiotensin system inhibitor, such as an ACE inhibitor or an angiotensin receptor blocker, combined with a long-acting calcium channel blocker, such as amlodipine. This is found to be more effective than the combination of a renin-angiotensin system inhibitor with a hydrochlorothiazide or thiazide diuretic, and should be the favored first choice single pill combination medication for the treatment of hypertension.
Yeah, that's great. Thanks, Rob. I agree with all of that. I'd also just add that the use of these medications has actually gone down over time, despite all of the evidence that we found supporting their use. And so I think the next step in this field of research is understanding the barriers to why these medications aren't being used and try to address those barriers. So with that, I'd like to thank the writing group for all the work that they put into this manuscript, and to the staff at the American Heart Association who supported us along the way as we developed this manuscript.
Let me echo those thanks, and also thank you to you, Jordan, for your leadership in this scientific statement.